I'm Dr. Kuyunov here at Dental Prosthodontics of Rochester, and today I'm going to answer some most common questions about implant-supported dentures. What are implant-supported dentures and how are they different from traditional dentures? So, traditional dentures rely really on just the gums to provide suctions and bone and gums, nothing else. And sometimes it is difficult for patients to have dentures. There are some challenges associated with it. For some people it works, but for many people it really does not work. And that's how implants came into a picture when implants were discovered as a viable option for us, for people. We started to incorporate implants into dentures and anchoring dentures to the implants. And the way it works is that the denture will kind of be anchored by the implants. And here is, for example, uh, a, a jaw of a person and a regular denture. However, the two implants that we have are attaching the dentures to the lower gums, and it attaches with a snap-in mechanism. It snaps and it doesn't come out. So it's even hard to remove it. But we have the denture itself has the female type of attachments, and inside the jaw, on the lower jaw, we have the two other parts of attachments, and they both click in, click out on each other. It's a snapping mechanism, and that makes the lower denture as a very good viable option for many people who could not have regular traditional dentures before. Just to expand about this is that when we read about McGill consensus that was published a few years ago, and it was a group of dentists coming together, oral surgeons, prosthodontists, general dentists from different parts of the world, coming together and finding out, okay, what do we do with people who have dentures, and is it still a good option? Because many people, their satisfaction levels with dentures is not very high, is kind of low. So they came to conclusion that for the upper jaw, a full denture, it is still a good enough option. However, for the lower jaw, the minimum standard of care should be 2 implant over denture, just like here in this option. That is was the conclusion of McGill consensus, saying that 2 implants over denture is the minimum standard of care for a lower jaw that has no teeth at all. So that's why the overdenture option is really should be considered very strongly for somebody who does not have any lower teeth as the first line of treatment. How do denture implants work, and what does the process involve from start to finish? It involves doing all the steps that a dentist will usually make to fabricate a denture. So as many steps as it takes to make a denture. However, the other part is to place the implants, and implants is the second part of this whole treatment. For implants, obviously the patient has to come, have a special image taking, which is called a CBCT image. This type of an X-ray shows three-dimensional value, how much bone there is, and whether a patient is a good candidate for implants or not. In addition, medical history is reviewed, making sure that there are no medical contraindications to place implants. So this is important. Once we pass the diagnostic stage and we find out that the patient is a good candidate for implants, the implant surgery is being scheduled. Ideally, for this surgery, we want to have some type of a guide for that type of surgery. Usual guide will be having a pre-existing denture, which is good, and if there is no denture at all, we have to make a denture even as a temporary appliance, temporary denture for you. This will be a guide on how and where to place the implants. We also want to find out with this type of a guide, do we have enough space for implants? For example, rare conditions, but it happens, patients loses teeth and it got used to bite gum against gums. So both gums are touching. There is no space for teeth to place them there. It's just gums against gums. In this type of situation, whether we place the implants or not, there is no space for new teeth. and that's not a good option for you. No dentures, no implants. So this is part of the diagnostic workup that the dentist should make, is to find out, is there enough space for denture supported implants? Is there enough space for the implants? And is there enough space for all the attachments that attach the implants to the dentures? So it's a lot to take in, but that's part of the diagnostics. Once we pass over it, obviously, and we have a diagnostic denture that will guide us through the process, then the surgery is being scheduled, implants are being placed, and then it's a waiting time of about 3 months for the implants to integrate into the jawbone of a patient. And during these 3 months, you will have your regular dentures to use or whatever you had before. But after these 3 months are very important, because what they provide your natural bone growing into the implants, and it will grow into the implants and attach the implants strongly to the bone. And now, after 3 months, when the implants are strongly attached to your bone, now we can use them. What happens if we try to expedite the process and do it much faster? If it's a removable denture, every time you put it in and out, and it touches those implants and it moves them a little bit, the bone will grow into them not as strong as we would want to. And unfortunately, we may risk a failure of those implants. So there are few schools of thoughts and different philosophies. The most common one is to leave implants without touching them for 3 months. And after 3 months, we can use them. Then we can use the denture to attach to those implants. Now, if you have a pre-existing denture and you like the way the teeth are, you like the color, you like the denture, but you would like to add implants and to make this denture snap in on implants, we don't necessarily need to make for you a brand new denture. We can use your denture and convert it, do small modifications on the denture to attach it to those two implants, 2 or 3, sometimes even 4. Really depends on the scenario. So this is one way of doing it. The other way is that once we have the 2 implants and we have a pre-existing denture and you are not happy with this denture, then we make a brand new denture for you from scratch. Once we have the 2 implants in place, make a brand new denture, ideally using those 2 implants with the attachments in place as well, finishing the process. And on the last appointment, you will get those dentures attached to the implants and you will go home with follow-up instructions on how to take care of your dentures. What is the difference between snap-in dentures and permanent denture implants? Okay, so the snap-in dentures, it snaps in. You can remove it in and out, in and out. It snaps in. Okay, it clicks, and you're able to remove it, clean it, and it's like a regular denture, but it's attached to the implants. That's a snap-in denture. Okay, permanent denture on implants. We call it permanent denture. It's not really a denture. It's more like a bridge. And when there are a few implants, we speak about 4, 5, 6. Really depends on the situation. But at the minimum of 4 implants are being placed into the jawbone, and then a bridge is being attached. But this attachment is more permanent because it has screws that screw it into the place. Okay, so once it's being screwed in, you as a patient cannot remove it. For you, it is like any other fixed bridge. You're responsible to clean it and keep everything clean and healthy, but you cannot remove it. Your dentist can remove it, and we do remove it sometimes. And in order to check on those implants, to make sure it's all clean, and we then place it back, screw it into place, and you are good to go. There are a lot of benefits of having a screwed in type of a denture, or a bridge, should I say, as opposed to a snap in, snap out. In this case scenario, you don't really have to worry about taking it out or not. It's there permanently. As far as you're concerned, it is fixed and permanent. And people really should not know that you have fake teeth, even though it's fake prosthesis. It's a prosthesis, but it's a very good replacement for what you used to have naturally. who is a good candidate for implant-supported dentures? Um, a, a good candidate for implant-supported denture is a patient who does not have any medical contraindications or other contraindications. So I'm just going to mention a few of them. The most common ones are smoking. Smoking was shown to decrease the success of implants in human beings. Only because smoking, different reasons, but smoking does create an environment which is not healthy for implants, and the risk of failure is increasing with smoking. That's one. Another one is medical conditions such as diabetes mellitus type 2. By itself, if it is well controlled, it's not a contraindication. However, if it's not controlled, then it decreases the success of dental implants. What is a well-controlled diabetes? It's usually being checked with hemoglobin A1C. Your doctor will do these exams. It's a blood test. It shows the last 2-3 months of sugar levels in your blood, and if the levels are at a 5.5, maybe 6, that's an okay area. Once it's getting into the 7, it's a red flag. Anything above 7, 7.5, that's usually we ideally want to wait until the levels are decreasing to more less risky levels. Other contraindications include different types of medications. For example, there are some bone density medications that people take. These are usually for women after menopause stage. The bone density decreases, and the doctors recommend to take some bone density medications. Some of these, you should read obviously the labels and the risks of these medications, but some of them do say that the healing of bone is not as good as without these medications. So if you have any extraction done when you are on those medications, the extraction site may not heal properly. And the same applies for dental implants. If the dental implant is being placed while you are on these medications, the implant may not be successful and may fail. So there are different medications that will contraindicate implant placements, or at least will pose a risk for us, and we want to inform the patient to know about it. Um, so what other things that can be contraindicating for people? A good candidate is somebody who will follow up with somebody who will have good oral hygiene. That is also important. Taking care of your implants is as important as taking care of your teeth. And if you lost your teeth, you still have a chance. But dental implants, they do require some maintenance at the doctor's offices, plus doing the oral hygiene at home, as is being described by your dentist. What is good to do. Other conditions that can, pose problems are people who grind their teeth. People who grind their teeth, they need a little bit. They need stronger implants, maybe sometimes a bigger number of implants, and maybe different type of prosthesis, something that is stronger. Because with bruxism, there is more forces applied by the muscles to the jawbone, which is then translated to the implants and teeth. In conclusion, a person who is a good candidate for implant is somebody who is healthy, has good oral hygiene, uh, does not smoke, and does not have an uncontrolled diabetes, and has no medications that can decrease the success of dental implants. What are the benefits of choosing denture implants over traditional removable dentures? So traditional removable dentures, they are just attached to the gums as it is, and we rely on the tongue and cheeks to try to keep it in place. Also, suction that is created between the denture and the gums will hopefully keep it in place, and that is important. And at times we can achieve this type of suction and retention, but it's a loose suction, and it can come out easier than if there were implants. In terms, implants have superiority to it because implants do anchor it, and we rely on everything else with a denture, but now plus we have the implants as well that will help us attach it. So that's the beauty. Now, if you speak about fixed bridge, then we don't rely at all on the gums. We just rely on the implants, and implants just keep it in place, and it's fixed and it's very sturdy. So the biggest superior factors is it's you don't feel like it's going to fall, and if the patient has problems with regular dentures and implants are an option, I would recommend to look into this option as it can really help in improving the lifestyle and satisfaction of a person. Uh, in terms of chewing, smiling, and social benefits, everything will improve. If the regular dentures don't work, the implants they do adds a significant benefit, and it was shown in many studies that the satisfaction levels of people do improve once we introduce implants into dentures. What should the patients expect when they are getting full mouth denture implants? Okay, so um, you should really expect to have some adaptation period because when you get at the beginning, when you start the process, it's a transition process until you get the very last fixed prosthesis, the very last implant supported or retained denture. It's all transition period and it can last anywhere between 3 to 6 months. So that's the number to have in mind. Anywhere between 3 to 6 months is a transitional time. It's not the easiest of times, but once you're past it and you get your final prosthesis, that's when you are going to be happy and you will get what you were looking for. But like any other surgery, there is some healing time for the surgery, and that's really the healing time. You expect coming for once all the diagnostics have been done, coming to the surgery, going through the surgery, and then having some healing after the surgery. Some of the healing you will have a temporary appliance, whether it's going to be a removable denture or a fixed denture to the implants. It is still a temporary appliance. And as a temporary appliance, we want to treat it carefully. We don't want to break anything, and there will obviously be involved some soft diet and careful chewing with this. When you get the final appliance, you'll be able to get back to your normal life, normal chewing, normal social life, because then we have the final and it's sturdy and it's strong and it's attached to your implants. Are there any differences between upper denture implants and lower denture implants? The prosthesis itself is the same. Number of implants can vary. The biggest difference is on the lower jaw, regular denture can move. The anatomy is not as favorable as the upper denture, and that's why we strongly recommend doing implants on the lower jaw. That's why the McGill consensus spoke about minimum standard of care of 2 implants over denture. So for the lower jaw, whether it's a removable implant retained denture or a fixed denture on implants, it's a great solution. For the upper jaw, the denture itself can sit well and will have good retention in many people. However, the palate is being covered by the denture. The denture will have to cover the whole palate, and that's how it gets its stability and retention. We do have taste buds in the palate, and it does affect the taste of a person. It also affects the speech in a way. So these are the few things to consider is that when it is a removable appliance, there is some adaptation in terms of speech and sensation and taste feelings. With the fixed appliance, the palate does not exist. It's going to be a clear appliance. There is no palate here. It's all open, and people like it a lot when the palate is not being covered. Many people like it, and they prefer not to cover their palate. They prefer to keep it as it was with their natural teeth. Natural teeth did not cover the palate. So these are the major differences between the upper and the lower implant fixed prosthesis. How much do denture implants cost, and what factors affect the overall price? So the cost does not really vary much. In between places, it's almost there is a range. There is some low cost, some higher cost. What you're looking for at is the attention that you will get from the office, is the caring and the trust that you give into the office and your provider and the whole team is the whole vibe. So once we speak about this, the cost of a denture, the range, most people decide which place to choose based on their feeling, their trust, and what they get in addition to just the the implant dentures. I would not necessarily go to the place that is the least expensive or the most expensive. but I will go based on the provider, see what they have to offer, see what other patients got, and how they speak about this type of treatment, and get overall feeling. In our office, we do provide good follow-ups. We provide support from beginning till end. Whether the surgeries are being done here or in a different office, we hold the hand of a patient until the very end, and we make sure that you are being taken care of at all stages, because it is not easy going through it. So that's the whole team is very supportive of a patient. So we hope to provide a good treatment plus good support overall. Are there affordable denture implant options available for patients? Yes, there are different types of implant supported dentures. If it's a fixed option, is a more expensive option. If it's a removable option, it's a less expensive. So again, if we are looking into the patient, all right, and there is a fixed option and it's being screwed in, that's the more expensive price-wise option, but it's a fixed option. But if it's not within the budget, the next option with implants will be the snap-in, snap-out denture. So it's a denture and it snaps in. This applies for the upper and lower teeth, both of them. So the snap-in option is the less expensive one to go. People ask, can we do from snap-in? If I don't like it, can I go to the fixed option later on? As long as we plan it ahead of time, the answer is yes, it can be done, going from a snap-in to a fixed by adding few more implants. Yes. For the lower jaw, it's actually more common to do it. For the upper jaw, planning at the beginning stages is important, and just having in mind that maybe the snap-in is not going to work, then we have to plan placement of implants in a certain direction so the fixed denture can fit as well, not only the snap-in. But the answer is yes, we can convert from the snap-in to a fixed option. What should patients look for when searching for denture implants near them? When looking for denture implants near you, look for an office where you will feel comfortable being treated, making sure that you have good sense of the staff or the support they will give you, and all the preparatory steps. That's also okay to speak with patients who had similar treatment in the past and see what their experience was. This type of research is totally okay, and it helps a lot of people to make a decision. Another way is to speak with your dentist and see what the dentist thinks about it and what he will recommend. The price and the cost really should not be a factor when you choose this type of treatment, as it really depends on the skill and the support that you will get along the way. That's really the most important part. I hope I've been able to answer some of your most common questions about dentures and implants. For any additional information, if you may consider it or want to find out more information about this, please contact us at our office. Our phone number is 585-471-5689. Thank you.